during this Man on the Move, I come to you from our mental health hospital with the director of our mental health program, Dr. Barry Mills, who also serves as the program director for the psychiatric residency program. I've heard, Dr. Mills, that there has been some tremendously positive news this past week. Maybe you can share that with us relative to our residency program.
We are very excited both for the hospital and for the community at large. The Accreditation Council on Graduate Medical Education has approved Kaweah Delta to be the newest psychiatry training program in the United States, which is not an easy task to get accomplished. These things only come around about once every 5 to 10 years, so it's been a long process, a lot of work, but we now get to add it to emergency medicine and family medicine and hopefully some other specialties in the future.
Yeah, excellent. I want to share with you that I know personally that Dr. Mills worked a great deal to make the program information submission look terrific and be terrific. We are in fact speaking to you today from the resident lounge here at the Mental Health Hospital, which Dr. Mills and his wife have made look beautiful and attractive. And in that regard, Dr. Mills, maybe you can tell us how soon we will see our first residents and how the program will grow over time. And what's the experience of a resident when they're here?
No, excellent questions. Having gone through the process myself, it's both a personal experience on multiple levels. The emergency medicine residency program and the family medicine program start this July 2013. There are about 12 doctors that currently Kaweah Delta does not have, Visalia, our community does not have, that will now be available in those specialties. For psychiatry, we are on the second round. So in July of 2014, we will have a group of people that just graduated from medical school. So they're doctors, they're MDs, but they have decided to specialize in psychiatry. That takes an additional 4 years, full-time. They are working. They're also taking classes intermittently that we offer here as part of our faculty, but the key aspect is that they will be here for 4 years learning psychiatry, and also an additional benefit for our community because mental health care across the United States is, there's a great shortage no matter where you at. You can go into a major city and there's actually a shortage of mental health providers, but in more rural or agricultural areas it becomes a much more critical issue because people will want help, they need help, and then they start making phone calls and there's a 3-month waiting list, and that's just not good enough. So part of our goals is to attract psychiatrists to the Central Valley, to train them, and to be also immediately available because these doctors can prescribe medications, they can see people, do evaluations. During the residency, it's all under the supervision of one of the faculty docs, like myself. We have 20 other faculty doctors on the psychiatry department staff who will be directly supervising these folks. So we don't have them yet, but as of 2014 you'll be able to call and get appointments, and hopefully the kind of traditional waiting list that becomes a problem for people sometimes will go down dramatically.
So it sounds like the residency program will not only train these new psychiatrists that are much in demand, but really provide very direct services under the supervision of those that are leading the program, direct services to the patients.
Yeah, absolutely. There's a long-term effect because the studies indicate that where doctors do their specialty training, a lot of them stay in that area. And you can imagine that. Their families are comfortable there, they've learned to like it. We're actually going to particularly recruit for people that are from the Central Valley or have attachments to the Central Valley. But in addition to that long-term effect that may be 4 years down the line, there will be an immediate effect. There will be appointment slots available that did not exist before. So we're very excited about this. One of the, as the medical director, one of the saddest things I see is when someone is really wanting help, could benefit from the help, needs the help, and we just don't have the doctors to do the job at that time. This is a huge step in that direction to improve that.
Excellent. Well, Dr. Mills, I want to offer my personal commendation for your tremendous efforts professionally and personally to move this program forward to this very successful conclusion. It is an enormous success story for Dr. Mills, for our mental health hospital, and the entire district and community to have this psychiatric residency approved. You should feel proud as well, because it will make a difference now and in the long term for Kaweah Delta and our community. Congratulations and thank you, Dr. Mills, for joining me on this Man on the Move.
Thank you so much.